Infectious disease specialist Dr. Todd Ellerin again. Dr. Ellerin, thanks so much for being with us again.
Good to be here.
So with the United States continuing to shatter COVID-19 case records, what should people know and what should people be doing ahead of New Year's Eve celebrations this weekend?
Right, Phil. So I think it comes down to vaccination, ventilation, and validation. We know that the vaccines work. A recent study that just came out from Denmark showed when you look at about 12,000 Danish households, those that were boosted had less Omicron transmission. That's very, very important. And while Omicron is certainly more contagious than Delta, that's another reason why we want to optimize ventilation. So just by opening windows, 6 inches, you can really change the ventilation of a room. And that's key. Remember, it's getting colder, so it's not easy to keep it open for long periods of time. But even opening it up for 15 minutes or so at a time is helpful. And then, of course, validation. What's really important is know who the people are that are coming into your home. Are they vaccinated? Are they boosted? And it's okay to say to someone that you love, you just can't come this New Year's Eve. I love you, but you coming in sets us up for an increased risk of transmission, whether it's that person getting infected and bringing it into the rest of the people in the home, or whether it's the people in the home that are positive and giving it to that unvaccinated person. So this is the time for tough conversations.
Today, CDC Director Dr. Rochelle Walensky spoke with Good Morning America regarding the concerning announcement from the FDA that rapid antigen tests may not be as sensitive at detecting the Omicron variant. Let's take a listen.
We do know that the most sensitive test that you can do is a PCR test. So if you have symptoms and you have a negative antigen test, then we do ask you to go and get a PCR to make sure that those symptoms are not attributable to COVID. But those antigen tests still work quite well, and they work well, especially in places that we're using like in higher education, in tests to stay in schools where we're doing several tests, one every other day, every third day, and that's really when they work well as well. So we still are encouraging their use. They may not work as well as they had for the Delta variant.
So having listened to that, doctor, and you know how that information can land on different people depending where they are in the country and what COVID is like in their particular area, should people be trusting these tests as much as they did say yesterday before Dr. Walensky said that?
So I think Rochelle is spot on here. What she's saying is that these rapid tests may not be as sensitive, meaning as sort of as accurate as they were for previous variants, but they still work, and they work best if you can repeat it. So not just at one point in time, but if you can repeat a rapid, if you get a negative result, you can repeat it the next day or a couple of days later. Of course, if you can get your hands on the PCR, that's the best test. But let's face it, those are difficult to access, and they take time to come back. You may not have that time, especially if you have someone that or you have a party that you need to go to, within a few hours or the next day. So, but the thing that's important here, Phil, is remember, if you have symptoms and you test negative on that rapid test, you can't say definitively you don't have COVID. You really want to take the right precautions, and then, of course, test the next day if you can, either through the rapid test or try to get your hands on that PCR.
Just quickly before I get to the last question, you mentioned it. Should tests be hard to get 2 years into this? Right now, people are frustrated.
It's so frustrating. I know there are places that have really testing vacuums, and there are other places that have testing sites, but there are long lines. You would think that a country as amazing as ours could, get to a better place with testing, make it more available, make it more accessible, make it less expensive. Ideally, we'd have rapid tests that we could do every day at home. In other countries, they're much less expensive, much more available. I think we're going to get there. I have faith in our country. I know we're going in the right direction. It's just at a slower pace than we should be going.
Indeed. With pediatric hospitalizations rising across the United States, as you know, the CDC said today that booster shots could soon be made available for adolescents ages 12 to 15. So having said that, what else should parents be on the lookout, and what should they be doing to protect kids at the age of the kids we're seeing on the screen?
Phil, I'm glad you mentioned that, because remember, Israel has been boosting 12 and up since August. So we have a lot of real-world experience. We know it's safe. We know it's effective, and it's important for our country to shift in that same way. I think what is important, of course, is right now anyone 5 or older needs to be vaccinated. That's key. Anyone 16 or 17 should be vaccinated and boosted, of course. And the other layers of safety are important. And remember, we want to cocoon our children, especially the ones who are under 5 who are not eligible for vaccination yet. And what cocooning means is you want to make sure the people that surround them, the friends, family, teachers, whomever, get vaccinated as well. These are the things that protect our kids. Of course, masking in schools and other things work. So I think it's the same safety measures as we've been talking about since the beginning. We know what to do. We just have to go and do it.
All right, Dr. Ellerin, always good to talk to you. Thank you so much.
You too.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.